If you came from my previous video, you'd understand that osteoarthritis isn't really due to wear and tear, and it's much more complex than that. And exercise being the first-line treatment would be contradictory if it were. This thought of osteoarthritis being due to wear and tear is harmful because it creates a fear of exercise. It puts you in the mindset that using your joints is damaging them, and exercise just speeds that process up, which it isn't. Many studies have shown that exercise is safe for the joints, it doesn't degrade cartilage, and they do not lead to an increase in inflammation in the joint. Another 3 points to osteoarthritis not being due to wear and tear. These points show that exercise is safe and not damaging your joints, and this is why guidelines consistently recommend exercise as the first-line treatment. Now, just saying exercise is pretty broad and is not very specific. Do the guidelines recommend anything in particular? At the moment, it hasn't consistently been shown that any exercise is better than another, so every exercise helps. Doing something is better than nothing. This is why it's important for your healthcare practitioner to work with you and find things that you enjoy and can stick to. Since all exercise is shown to be safe and helpful, it's less about osteoarthritis itself and more about meeting the guideline requirements for activity so that you can age well. With arthritis, the biggest burden is physical inactivity, and then you being able to do less because of that physical inactivity. Or in other words, functional decline. The best way to combat this is to do a combination of cardio activities like walking, running, biking, swimming, anything that kind of gets the heart rate up and gets you breathing heavy, along with strength training. So lifting weights is going to be one of your best friends. Now that I've said that, the key to exercise is to start off small and slowly build up so that you're working within your capacity. This means that maybe instead of running right away, you start walking. Maybe instead of lifting weights, you just start off with bodyweight squats. Exercise can be scaled down to any level and then progressed as you get stronger. Again, this is why it's recommended to work with someone who understands osteoarthritis and exercise and who will work with you to understand your personal needs at the moment and progress you properly. So how much exercise is recommended by the guidelines? Well, here in Canada, it's recommended that you get 150 minutes of cardio in a week. And I know that sounds like a lot, but you can do this in very small increments. You could even do 2 minutes at a time if you want it. Again, going back to working within your capacity is very important here. Your healthcare practitioner should start you off with appropriate goals and progressions so that the exercise is manageable. Along with the cardio, you should be lifting weights or doing some sort of strength training for your whole body 2 to 3 times a week. Okay, now we're getting somewhere with structuring a workout program and understanding how to exercise with arthritis. Again, all of this has to be within your capacity and starting small. So your program is going to look a lot different than someone else's. Even though we're getting closer to understanding exercise and understanding what to do with these recommendations, they're still pretty vague and leave a lot of questions on the table. How much weight? How many sets? How many reps? What is a squat? Again, this is why guidance from a professional is very helpful and important. But for the sake of this video, there is some evidence that digs a little bit deeper and talks about how hard and how much you should exercise. To start, exercising isn't something that you just do for 4 to 6 weeks once a week and then you're done. You have to continually exercise, and it's something that you should do for life. This will help to keep you from losing your independence, as well as allow you to do the things that you love for a lot longer. Okay, back to the point. How much should you be doing in your workouts? I like to structure workouts with a full body focus so that you're hitting all of your muscle groups enough times. The evidence shows that getting 2 to 3 sets for every major muscle group in your body every workout is a great goal to have. This doesn't need to be done on day 1. You can slowly build up to this over 6 to 8 weeks. The major muscle groups would be your chest, your shoulders and arms, your back, the front of your legs, the back of your legs, and your calves. Now I know this sounds like a lot, but a lot of exercises work multiple muscle groups at one time. For example, working your chest and working your back often works your shoulders and arms as well. Now let's start to break down how many reps in a set and how much weight. The evidence shows that doing 7 to 9 reps per set and getting about 5 reps away from failure in that set, that means that if you did 5 more reps, you physically wouldn't be able to lift the weight anymore, is a great goal to work towards. You don't have to actually test where your failure is. You can estimate it, but just know oftentimes you can do a little bit more than you think you can. I mentioned earlier in the guidelines it said to do this about 2 to 3 times per week, and with that you should give at least a day between the sessions so that your body can rest and recover. This will allow you to make some serious gains and get nice and strong. Now that you're armed with this awesome information, you can find a healthcare practitioner that'll help you use it and guide you to live a fuller and more complete life and help you move past pain. If you're still confused about what exercises work which muscles, then I have another video going through some examples that can help with your understanding. But for now, go out there and move.